Well, we're having a great day today at the NCL Cancer Conference, and we've heard from some really great speakers. Francis gave us an overview of our cancer context, where we're doing fantastically well in survival, but we have challenges with our performance and patient experience, and really trying to tackle our health inequalities as well in cancer. So there's a fantastic vibe, fantastic presence from so many people today across all sorts of industries and organisations who come together to really think about how we can put our great minds together to beat cancer in North Central London. And one of the key takeaways for me so far has been the sense of community. Actually, we can achieve so much more by working together, by bringing in that partnership and bringing all those different attributes and skills we have from our various different industries and sectors that we work in, and have a common goal and focus on cancer.
So, the Royal Free, not many people know this, we are the second biggest cancer provider in the UK actually, the biggest in London. We have about just north of 50,000 referrals from both our local population but also nationally every year with suspected cancer. And as we've heard today, the numbers of treatments and the numbers of diagnoses are just going up absolutely exponentially. There's some really incredible stats. 1 in 2 of us will get cancer now, and we know that already we are diagnosing with someone with cancer every single minute in the UK. I mean, that's just scary. So it is a fundamentally important part of who we are and our responsibility, not only to our local population, but also those specialist services that we provide.
It's brilliant to be here at the North Central London Cancer Alliance, partly because some of the things that are happening here really are leading the way nationally. So I know you're going to be the first Cancer Alliance, for example, to invite all eligible people to a targeted lung health check. And that is the kind of programme that we can see is making a real difference, not just to outcomes, but to patients' lives as well.
It's been a brilliant day. It's been great to see so many people from across our community, healthcare workers, voluntary sector, policymakers, and firstly, to see how proud I am of some of the amazing work that's going on in NCL in terms of changing the way we deliver cancer care. But secondly, full of hope for the future, really. Yeah, I mean, I'm really proud of UCLH, but actually I'm proud to be part of this community of healthcare providers, primary, secondary care. You can just see and hear the passion people have about wanting to change the lives for people with cancer, but also change the lives of people without cancer early and make sure that we can detect things and treat people as early as possible. It's very uplifting.
So as ever in NCL, massive energy and commitment to doing the right thing for our patients, residents, carers, families, which is always very, very energising. I think secondly, the recognition that although we've done well, we've got a journey to go on. We know that there are places we could be doing better. We know that some of our communities are underserved, and we need to do better to reach them, to build up early diagnosis, and for cancer to be something that people can be confident that they will survive, that they will get the best treatment, and that they will be able to return to living their lives post-treatment with the right psychological support. We have a fantastic hospital system in North Central London. We have some world-leading hospitals offering cutting-edge treatments. However, we've got to really get to grips with this concept of neighbourhood health and people understanding that they understand the signs in terms of what may be an early sign of cancer, that they have the confidence to go to their GP, but also that they can get there and they can get the support locally. Of course, our hospitals are there for the people that need them, but we want to see fewer people ending up in hospital because we want to do more work on prevention, more work on early diagnosis, more work on screening, so that the numbers who end up going through treatment for cure or for palliative care are in proportion to those cancers that we are preventing.